Hi, it's Mike Keenan from KM Fitness. Today we're going to be talking about impingement syndrome. It's a common shoulder injury. It causes a lot of pain and discomfort trying to sleep, activities of daily living, and any type of sports-related activity. So before we get into what impingement syndrome is, I want to just go through a very quick review of the anatomy so people can kind of understand what bones and what muscles and what ligaments and tendons and so forth come into play with impingement syndrome. Now, impingement syndrome can either be a tendon problem in the case of the supraspinatus tendon, or it could become a bursa problem. Okay, and there's a subacromial bursa that can become inflamed, and that can cause pain and discomfort in the shoulder joint with motion. Okay, you also have the possibility of having a rotator cuff tear. Okay, and that's something that's diagnosed by your physician. You'll demonstrate weakness and pain, lack of motion, that sort of thing, and it can be diagnosed both objectively by a physician and also by MRI. So let's go through a little bit of the anatomy real quick. This is a posterior view of an individual. So you see the spine here, and then you have the collarbone, also known as the clavicle. The big bone here, which most people refer to as the wing bone, is the scapula, and then you have the arm coming up into the glenohumeral joint, and that's called the humerus. Laying beneath the scapula are the ribs, and there is some articulation or meeting between the ribs and the scapula called the scapulothoracic joint, but we're not going to take the ribs in consideration in this particular example. Okay. So those are the bones, and then you have the supraspinatus with its tendon that connects to the humeral head as well. And this is typically the tendon that is problematic with impingement syndrome. Then you also have the infraspinatus and teres minor. Okay? And the job of the teres minor and the infraspinatus is to rotate the arm or externally rotate the arm. Okay? Typically these are not tendons that really come into issue with rotator cuff tendinitis or impingement syndrome. It's usually the infraspinatus tendon, and you can tell it could be a problem because it's the only one that really comes between the arch of the scapula and the tip of the clavicle. So the tip of the scapula is called the acromion process. Let's just do a little bit of reference with the joints. Up by the sternum in the front, which you can't see here, and the clavicle is the sternoclavicular joint. And then you have your AC joint. So when someone says they've had a separated shoulder, they're talking about the ligaments that connect the end of the collarbone or the clavicle to the end of the scapula. When those those ligaments become torn, and the collarbone is able to ride up high, that's called a shoulder separation. Versus a shoulder dislocation. When they talk about a shoulder dislocation, they're referencing that the glenohumeral joint has been disrupted, that the head of the humerus has come out of the joint and is now out of location. Same thing with the subluxation. Subluxation, the bone goes out, comes back pretty quickly, where a dislocation, the humeral head stays outside of the glenoid fossa and has to be put back by a physician or a very good athletic trainer. But that's another story for another day. All right, so let's talk about some of the mechanics that kind of come into play here. In case I haven't mentioned it already, the little green patch here, that's indicative of the bursa, because there is a subacromial bursa. If that becomes inflamed, that is a source of bursitis, as people talk about. Okay, how do you differentiate between a bursa and a tendon? If you go to lift the arm up from the bottom against resistance, so if someone was to put resistance against my arm and I'm trying to lift it, if I have immediate pain, that's pretty indicative that the tendon is inflamed. Whereas if I lift the arm up and you don't have any pain until I come up to the top, and all of a sudden there's an immediate onset of pain, that's usually indicative of a bursa. And if there's a rotator cuff tear, you'll have a lack of function. You won't be able to push out against the resistance at all. Okay, so how can impingement syndrome occur? What are some of the mechanisms of this problem, and how do we go about trying to correct them? Okay. Well, in a normal shoulder, this image down here, we're demonstrating that as the arm goes up over the head, okay, the scapula, or the wing bone, actually starts to rotate, and they call that the scapulohumeral rhythm, okay? But if the scapula gets bound down, whether the muscles that are holding it to the ribs and to the spine become very tight and not very flexible, the scapula may not rotate properly, and without it rotating properly, the humeral head will come up and start to pinch off the supraspinatus tendon. Okay, how else can this be created? Well, if you're doing very heavy bench pressing and your back is being pressed down into the bench by the weight that you're lifting, and the scapula does not have freedom of movement, as you start to push up, you can actually cause an impingement syndrome because you're not allowing the scapula to move through its normal motion. Okay, so traditional impingement syndrome is a pinch of the supraspinatus tendon. So let's look at that tendon a little more closely. If this is the normal thickness of the tendon, and every time you come up you pinch it, you cause some bleeding to occur, okay, the tendon starts to get thicker and starts to scar down a little bit. And the thicker it gets, the less room you have between the end of the scapula, called the acromion process, and the tip of the clavicle. Okay? So the thicker it gets, the more scar tissue forms, the more frequently it starts to pinch. Okay? So to correct that, we would usually use anti-inflammatories and rest, and then we'd go ahead and start to strengthen the other muscles of the rotator cuff to try to keep the humeral head in place. There's also something called the beaking or hawking of the acromion process. Okay, that's usually due to prolonged trauma. You'll actually start to see a little bit of a growth. So if your normal acromion process looks something like this, with time, with arthritic changes, it could start to look like this. Okay? And that's going to be a source of pinching on the tendon as well, the beaking or hawking of the acromion process. Here's another picture of what happens with bursitis. The bursa starts to grow, get thicker, it pushes up on the tendon, and you compromise the space in which the tendon can move. Now, one thing I did not talk about, I'm going to save it because I wanted to draw it in on this picture. The rotator cuff muscles are really designed to control the humeral head, to put it in the proper position as you lift the arm up or to the side, okay? Kind of like sailors trimming the sail, okay? What happens is you have a large number of muscles that also affect the humeral head. Coming up from the back and coming up, you have latissimus dorsi, which also attaches to the humeral head, okay? Coming off the shoulder and down this way, you have the three deltoid muscles, and in the front you can't see, you also have pectoralis major coming across in this direction. And these are all very strong, very powerful muscles. So they'll pull the humerus up or pull it down or pull it across the body, okay? And as all those large muscles are working to move the arm, it's the job of the rotator cuff muscles to position the humeral head and keeping it in a normal approximation. And what the supraspinatus does, and why it's such an important muscle, okay, is it actually causes the humeral head to glide inferiorly as you lift the arm up overhead. Okay, and why is that important? Because if the humeral head doesn't drop as you lift it overhead, it'll come up and it'll cause impingement syndrome. So, if you keep lifting aggressively, overhead pressing, bench presses, okay, anything with an arm starting to come overhead or across the body, with a damaged rotator cuff, you actually continue to make it worse. Because if these muscles can't do their job by positioning the humeral head, then the large muscles just keep pulling, and they keep pulling the joint out of its normal alignment, and just makes the problem a whole lot worse. So sometimes more is not better. Okay? If anybody has any questions at all with regards to the presentation today, I would love the opportunity to explain to you in a lot more detail. But hopefully this gives you a better idea of what happens with impingement syndrome, why it's important to exercise the muscles, and why rest is also such an important component to the healing of this. Okay, thanks. Have a great day. Bye-bye.